squeeze in one last question, so we're running out of time, but looking ahead, either to a very different new variant of this particular pathogen or an entirely new one which could affect very different populations, pick one or two key lessons, and I'm afraid it has to be quick, that you take
Sure.
from the experience you've had over the last 2 years that'll be key for response.
Key lesson is do what we did here in Chicago. We hired about 800 Chicagoans from our West and Southside, more than 90% Black and Latino, with no prior educational or work experience. They just had to be good at talking to people. We hired them to be our contact tracing team, and then they became our vaccine ambassadors. And now they're connecting people to treatment and to care. And being able for me to have a sustained workforce that is through community-based organizations, so that we also have 30 community-based organizations that all together have a network. They see themselves as part of public health. We grow and train folks without barriers to entry to become that public health workforce. And we need to sustain that workforce long-term and have it be flexible. So no matter what comes next, they can convert from working on diabetes or heart disease or food insecurity. They can convert quickly to any emergency preparedness response for which they would be needed. And that for me, it's not just about the stuff, it's the systems and the personnel to build it. And that's probably our biggest lesson here in Chicago. Trust the folks who are on the ground, train them, and build that human infrastructure, and don't just fund when a pandemic comes, fund long-term so we can build that infrastructure, make us a healthier country at baseline, and be able to build on the successes we've had in Chicago and respond even more effectively.